Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars and pigmentation, as well as a lot with collagen. And I want to go through this subject with acne and antibiotics because during my consultations the last couple of weeks, I've had a lot of patients ask me about what we could do kind of in the meantime for their acne. And some people just seem to be a little bit confused about when we could do antibiotics, whether that's oral antibiotics or topical antibiotics, and why they're so effective for acne. And sometimes I don't necessarily use traditional actual antibiotics. I use things that are more what we would call antimicrobials. We do things that are basically going to potentially help with the proliferation of the bacteria, but not necessarily actually affecting anything with like gut flora or even actually causing too much antibiotic resistance. So things that are along that category are usually more like the sulfa medications, the topical sulfur or dapsone. All those could actually be really, really useful for acne, for the bacterial component of acne. So I'll walk you through just what I do for acne, and then hopefully it can help prevent scars from happening. I know I showcased yesterday a lot with scars. Last few days I've been showing a lot with scars, but I think it's time also to talk a little bit about how we could prevent scars from happening so people don't have to suffer the trauma of scars. So I'll walk you through just that whole process, and if you have any particular questions, I'll be able to help you. I'll wait for a few more people to join us, but this patient right here, we ended up doing, this is with the Accure laser, which normalized oil production, but we did actually still do topical antibiotics for her as well. And so I did that actually, and for short bursts, I also did oral antibiotics because of the cystic acne that she had. I didn't want it to cause any scarring, and we were able to save her skin, and you can see that there's very, very minimal scarring afterwards. So definitely a success. And it gets confusing for people. They seem to think that there's an easy fix that we could just do without any topical antibiotics or anything like that. But you do something like that and you can end up getting scars, and we want to avoid that whole process. Even though I do a lot with scars, it's not like something I'm trying to have patients get scars. I want people to avoid it. It's really, really important to me that people don't suffer from not just the acne part of things, but also the consequence of acne. And that can involve the scarring of it, that can involve the pigmentation of it afterwards. All that is all a component of acne. And then of course the emotional toll that it takes as patients are, anyone with acne or with scars knows that there's this whole aspect where when you have acne, you're suffering and you're feeling socially conscious of that. And then when you end up having scars, you feel like really miserable sometimes because it's like, the acne's under control. You did a lot to get the acne under control, but now you're left with the damage on your skin, and it can be visible to a lot of people there. So we'll work through just kind of my algorithm, and hopefully that could help you guys out. So when you're going through acne and you kind of feel that like, you're hitting a dead end, or you're going to a dermatologist and you're potentially just on the cycle of medications and creams, just make sure that you're, getting appropriately treated. It's not just about like benzoyl peroxide, for example, and just like overly drying your skin. Some people just do benzoyl peroxide only, and then they sometimes will also just do oral antibiotics. Make sure you're on something topical, especially when it's something like this. So dapsone is a great option, really. You could be on dapsone for a while. Usually I don't do it for like too long because sometimes it can overly dry the skin, but it's okay. You could be on that. And I do that with, sometimes you can even do dapsone and clindamycin together. So there's a few different options that we could do to solve the bacteria. But until that gets solved, really, you're still going to have this chance of getting scarring. So really important for us to manage that acne, to make sure that you don't end up getting severe scars. Abir is saying, which treatment is best for pitted acne scars? So if it's tiny little pitted ones, that's usually going to be more with what I would consider to be ice pick scars, if that's what I'm thinking you're saying. So ice pick scars, usually what we want to do is actually we want to do TCA cross, potentially something like excision for little ice pick scars. I'm a current patient of yours, was wondering if it's considered a bad idea to get PDRN before my treatment for Accure. Are you referring to the Accure treatment for treatment 3R3? PDRN is fine. I haven't really seen too many people say that it's been amazing for scars or anything like that, but it's like overall people are saying that it seems to help provide a little bit of a glow for patients. Oh, for scar treatments. No, that's okay. It doesn't affect me for scar treatments. So if you want to do that, that's okay. And also, good seeing you on here, Han, by the way. Son is saying, I'm booking my consultation with you soon. Good, son. I look forward to seeing you. Are you going for acne, for scars? What are we going to be helping you with? I had a lot of patients this week, really a lot of patients that they were finding that they were, just kind of at wit's end with their acne. So that's why I wanted to talk about this, because a lot of patients that I have for scars, but people also want to address their acne so they don't end up getting severe scars. And it turns out that, it's like the same thing. It's been the same thing for, 30, 40 years. I feel like sometimes there hasn't been just much change with like the mentality. A lot of people still are being pushed things that really could overly dry the skin. A benzoyl peroxide cream, especially, like sometimes I think it's okay for spot treatment, but for some patients it really could overly dry the skin, and then you could end up getting more acne because you get more oil production from that, and then that ends up causing a lot of like a delay in treatment, and you could end up getting scarring from that. So that's why I want to showcase this for you. Yes, benzoyl peroxide could help, but sometimes it's overly drying. So Dapsone, a really, really good option, really. Or if you can't afford Dapsone, then a sulfur wash is a really good option too. 40 milligrams of Accutane daily. When could acne on the chest clear? Well, it depends. How much do you weigh, or how much do you weigh, Ken? Michelle is saying, would you recommend jumping to Accutane for scars or first try tretinoin? I'm scared of purging. Well, either way, you really could manage purging. So when you're doing tretinoin, you could actually just mix it with a bit of a moisturizer there for the first week or two, and less chance of purging. For Accutane, sometimes you could just start a lower dose and kind of incrementally go up. Zinc could help prevent that purge. A lot of times, actually, patients are still doing exfoliants when they're doing Accutane, and that's not a good idea. You can end up overly drying your skin. So things like that actually are little small tidbits that can actually help prevent acne from forming and during the Accutane process. How long does doxycycline take to work? Should I see results right away? No, it could take really, well, it depends on how severe the acne is, but usually within that first week, you usually do see it reduce quite well. But if it's something that like you expect that there's just still continuously going to be a problem, you're probably going to be on a longer lasting course until that oil production gets better controlled. Thoughts on microneedling for acne? Don't recommend it. Not something I would do. It's not that it doesn't, maybe it could help a little bit for some patients, but it's expensive, and I don't know why you would do that, because there's better options just topically. Topical antibiotics would help out really well instead of doing microneedling, which, you're spreading bacteria all over your skin into the open wounds there. Doesn't seem like a great idea. Could cause more scarring too. Wouldn't recommend microneedling really for acne. Elisa is saying, I'm 28 with severe acne scars, hyperpigmentation, deep pitted texture. Thoughts on Dr. Penn? Well, it's not going to help too much with that. You said that you have severe acne scarring, hyperpigmentation, and deep pitted texture. First of all, I don't really love anything which is like a rolling device or any device that's like causing more friction on the skin, which Dr. Penn potentially could do. If you're doing anything like that at home, then stamping devices are maybe a little bit better. But if you have severe scars, really going to be pretty mild to improvement, if at all, with even that stamping device. Subcision or microneedling, which one is better? It depends on what kind of scars you have. If you have rolling scars that are deeper, those are typically going to be only solved with something like subcision and some volume replacement. Microneedling will help a little bit with the texture, but really it's going to be very, very mild, so I wouldn't recommend that for the vast majority of patients. Let's see here. I know I missed a few questions, so I'll try to hit these up here. Some say wait a year for Accutane for acne scars, but you said it's fine to start soon. What's better? It depends on the dose that you're on. Depends on your weight. It's a lot of different factors. It depends on how much oil production is under control. Acne is under control, but yes, you could do scar treatments on acne on Accutane. There's actually now at this point we have enough data to really say it, but still some people will insist that you have to wait 6 months, a year. It's just not true. I've done it many times. I even have a lot of my patients when I do scar treatments on like a low dose form of Accutane even sometimes, and you'll see a lot of times that the oil production is better controlled, things like that. And part of it's because I have them on isotretinoin. So yes, does it cause more sun sensitivity? Yes. But it could help with healing because your oil production is better controlled. You get a better collagen response. So a lot of different variables there. But usually, if we can get your acne under control, your oil production under control, we can get you on a low dose of Accutane. We could probably do most of the scar treatments there. Someone was saying that they are 200 to 205 pounds, 40 milligrams of Accutane daily, middle of the chest. So that's a pretty low dose for chest acne. You probably have to be on a higher dose if you are 200 or 205 pounds. So you're looking at a low dose. It's going to take quite a while. I probably would go up on the dose first and then go a little bit lower there. Can dapsone be mixed with tretinoin 0.25 and 2% niacinamide, or would it be too intense for scars? I don't think it's going to really help much for scars, but it could help for acne. That combination is actually not a bad combination for acne, and then also a little bit for redness there. So that's not a bad combination there. Kaz MO is saying, is minocycline the only antibiotic for acne? I wake up with itchy palms and the soles of my feet. Well, you definitely could consider other options, potentially in the sulfur category, like Bactrim could be an option there. Or you may need to be on something like even just occasionally you could double check to see if a penicillin could be potentially an option. Just topical creams though, like dapsone is a really, really good option to start out with. You could do sometimes dapsone combined with topical clindamycin, works out really, really well. So there's a few different options, and I know people are hesitant a lot of times for antibiotics, but it's very, very different when you're doing topically. And dapsone isn't really like a traditional antibiotic. It doesn't cause like the gut problems or anything like that. It's also, like I said, it's topical. So really very, very low likelihood of running into any problems with that. Just some mild irritation or dryness usually for people. Do you give off work notices for recovery for acne scar treatments? Yes, I could. Just let me know what's going on with that. We could help you with that. I'm up is saying, why is it that some people grow out of acne and some don't? Like after a certain age, they just don't break out whether they wash their face or not. Well, oil, it does definitely fluctuate as you get a little bit older, and usually that's really due to hormonal changes. So as your hormones fluctuate, testosterone potentially is going down a bit. You're going to be a little bit less oily, and then you may not need to have as much of you may not have to do as much for your active acne. But that being said, I would not wait for that period of time to happen. I've had patients that say, I just waited for that to happen, but they ended up getting a lot of scarring in between that time. And by the way, how's it going? I'm up. Good seeing you yesterday. Frank Guzman saying, what are good healing ointments, non-comedogenic after microneedling laser procedure? Well, probably it depends on if you're talking about just right away. That's I wouldn't do much at all right away. But after the holes close, usually it closes about 6 to 8 hours or so afterwards. The next day, Vanning cream actually works really well, and then a physical sunblock. That's typically what I would do. So Vanning cream and as well as that. Dapsone versus tretinoin. I'm on Ziana, tretinoin, and clindamycin now. Thoughts? So dapsone actually could be combined with tretinoin. So tretinoin is really more for the oil production, a little bit of collagen stimulation there. And dapsone is really going to be wiping away some of that surface bacteria. It's a sulfa medication, so it'll help with that. So two different processes. It works really well hand in hand actually. And you're on tretinoin and clindamycin. So that actually, I would probably not do clindamycin for more than 3 months because of antimicrobial resistance. So probably consider being on dapsone instead. What would you recommend for acne scars and deep scars that's not microneedling? So really it depends on what kind of scars. If they're tiny ice pick scars, then do TCA cross. Potentially you could do excisions. If it's rolling scars, if they're pulled down, and then you likely have to do some subcision and then maybe some volume replacement. If it's these thick edges around the scar, then you need lasers and energy devices like that really to smooth it down, or peels. I did a really great phenol peel case today. He had very severe scars. I ended up doing it for that patient today. He's going to have a great result. We're going to see him again tomorrow. We'll do manual dermabrasion, so I'll break down the scars manually on the surface as well. It's me, LTC, saying Korean PRP a scam or good for acne scars. I never really found PRP to be great for acne scars. It does help a little bit for the recovery process, but I don't really ever find it to be something that's great for scars by itself. Does tretinoin 0.25 commonly cause purging? I just started taking it. It could, yeah. I mean, all different forms of exfoliants could cause purging. So usually just use a bit of moisturizer for that first week and it should help with that then. Heather's saying my face looks like that, or look like that. Okay, well, in the past tense, that's good. That's why I wanted to showcase this because a lot of patients, even you may be a parent and you may have a teenager that's suffering from acne. And it's really important, really, to intervene, like take it very seriously. I want to avoid as much as we could that scarring process is so catastrophic. In this case, I'm showing this because this is a really, really nice case because severe cystic acne got under control, very, very minimal scarring afterwards. So it's really nice. It's really rewarding that we avoided a very serious situation. She didn't even have to do anything for her scars, actually, as far as I remember, nothing else really. And she found that, in fact, her scars looked better after we did the Accure laser in her case. They shrunk a bit there. And it's really rewarding then, right? Like, it's like we got to avoid serious scarring, long-term catastrophic issues with that. And she's somebody who, here and there, she had acne in her teenage years and then had it again in her adult years. And it was really problematic for her. So it's like, this could have been a big catastrophe in terms of the amount of scarring. The amount of cost would have been really, really high to fix that. And we avoided all of that by solving the acne. So it's kind of funny, actually, in a way. Medicine is really one of the few things where we're trying to avoid you from doing things that we do. A lot of times, I do a ton of scars, but I actually want to avoid that process as much as we could because it's a big toll. Like, there's a lot that's involved with it. There's a huge investment with it, a lot of time, energy, money, all that. I'm really fully aware of all that, and I want you to avoid that if we could. And it's possible. Like, why should we let you suffer? There's people that just have a poor understanding of this because it's like my world, I could just focus only on the scar portion of things or the pigmentation part of things, but this is all part of it. The whole journey is really important for us to solve. And then if we got it on time, and in this case we did, we ended up avoiding severe scarring. So it's awesome. What comes first, TCA, subcision, or CO2? Really it depends. If you have those ice pick scars, how do you know that I always do the TCA first, and then I do the CO2 for the edges of the scar, and then I do subcision, and then I do a blended form of lasers. That's typically my way of doing things. Can antibiotics help with nodular acne and inflammation? Yeah. So, something like doxycycline does have an anti-inflammatory effect with it. So I do recommend doing that. And then topically, some sort of topical antibiotic as well. Again, dapsone, maybe we'll combine with clindamycin, or dapsone combined with erythromycin, all good options actually to solve some of that bacteria process, as well as a bit of anti-inflammatory effect as well. Am I able to do laser treatments during Accutane course as an East Asian without risk of PIH? Well, you'll probably be at more risk of PIH with it because you may be more sun sensitive. So, it's tough to say without risk. Even without Accutane, you're at risk of that. What treatment do you recommend for scars? If not microneedling, plus my face gets very red very easily. Which moisturizer is best to avoid redness? Well, if for scars, I talk about a lot of different options. Like I was just mentioning, sometimes you need a manual type of tools like Subcision for really when it's rolling scars. I know that there's a laser that people will say that that's all you need to do. It's part of the package, but it's not like the main thing, the only thing. I have to do a few other treatments, especially for the kinds of scars you have. So if there's ice pick scars, we're going to do TCA cross or excisions. If it's these deep, thick scars, we do subcision, and a lot of times we may do a little bit of volume replacement for that. So a few different options there. Does Accutane cause balding in men? It could, yeah, it could. I mean, it did for me. I found that my hair was a lot thinner on the sides, on the back of my head after Accutane. I was on Accutane 3 times, and really the second time caused more problems, and the third time caused a lot more problems for me. And just honestly, it was unfortunate. I'm glad I didn't get severe scarring. I'm really, really glad that I avoided all that, but at the same time, it was pretty frustrating to me. It really was. Like I think about it sometimes because I've heard patients, a lot of times, people go through their story and talk about like the cycle that they go through, about how many times they've been on Accutane, things like that. And it's really similar to my story. A lot of times it's like the same thing. And that was, when I was going through that was like 30 something, not 30, maybe 25 years ago or so. And it's like, the same stuff, the same situation, which is really unfortunate, which is, why I like the fact that we have an option like the Accure laser. It's really nice that we could do something to normalize the oil gland that doesn't cause other consequences like eye dryness or joint pain and hair loss. I mean, to this day, I still have dry eyes from Accutane. I had some hair loss from it. And a bit of joint pain. So I had literally all those different symptoms from Accutane. I also had a bit of a bit of depression for while I was on it. It's possible that it was because I had a bit of a purge while on Accutane, and it kind of each time I did have that, like a bit of a purge, and so it's possible that like that purge kind of affected me like that. And I was also like really, really dry. I had like really dry, super dry, chapped lips. And like I was in high school, especially like the first couple times on Accutane, and people used to always comment on like those dry lips and stuff like that. And so I think that was probably more the reason why I was like depressed with it. But it wasn't necessarily Accutane per se, but like that did affect it though. Let's see here. Corrupty is saying, I also had Subcision, but I don't see any difference. Well, it's there's a lot of different factors about who you went to for the Subcision, how they did the Subcision, and then sometimes there's volume loss, and so that may be the reason why you need that. You didn't notice enough of a difference. So, my patients, we definitely have a great success with Subcision. It works incredibly well, but sometimes you have volume loss. You have to go in there and actually put something for volume like Sculptra or Bellafill really to lift up that area. Are there areas of the face that are more resistant to treatment for scars than others? Yes, the lower part of the face, like underneath the jaw, that's a tougher spot to do. Along the jowl area, that's a tougher spot to go. Usually it's because you just can't go as aggressive. Temple is actually surprisingly pretty easy. Nose, I would say, actually is also a slower area to solve than lateral cheeks, easier area. So lateral cheeks, temple, easy. Forehead, actually pretty easy too. It's not too difficult for us to be able to get really, really great results. It can take a couple of sessions sometimes, but it's, pretty rewarding actually, because we could just lift up some of that volume loss, break up the scar tissue there really nicely, really quickly. And so a pretty rewarding area actually. So I would say probably the lower part, really that like along the jawline, one of the more difficult areas though. Does your Accure laser require oral medication for aftercare? No, it doesn't require. Very few people require oral antibiotics while using it. I usually just use topical antimicrobials like dapsone or clindamycin. Sometimes rarely like a little bit of benzoyl peroxide, but that's usually about it. I don't really do too much more than that. So no, it's not required to use oral medications there. Let's see here. Can silicone scar tape be used to help on pitted acne scars? And that can help so much for that. It's going to help more like the thicker edges of the scar. That's really what it's going to be more for. When do you prefer doing dermabrasion, and would you do it with Subcision? Dermabrasion is pretty rare, to be honest with you. It's really more for like thicker scars that aren't really going to respond much to other kind of treatments. If I do it with a phenol, it's a lot easier because the skin is really easy for me to break down, and we could do it really effectively that way. And then we could put some of the phenol indirectly into those pockets that we just created. So I think that's probably when I typically would do dermabrasion. Otherwise, I do it more with a laser. Like I use a laser for that dermabrasion. Just like I work on the edges there and I smooth it down with a laser. And I find that to be more precise, less chance of risk, less chance of hypopigmentation, things like that. Lychee Peachy, good seeing you on, by the way. Should I wait until after Accutane to come see you for acne scar treatment, East Asian? Not necessarily. It depends on how thick your scars are, how deep they are. We can always do a consultation. We could put you in for later on too. But as long as you're on a lower dose, it's okay too. So it doesn't have to be that you're off of Accutane completely. Can Accutane help with post-inflammatory erythema? Yes, it could. Most patients don't require too many treatments after we do the Accutane, for example, for the lingering redness. So usually we don't have to do too much more with that. Sometimes like a low dose of azelaic acid would be like, something that could help out with a little bit of niacinamide or something like that. But vast majority of patients, we don't actually have to do too much. It'll just calm down on its own over the course of a few months. It's funny, I was wondering not too long ago if there was a specialist out there who went through the same situation as us and made it their best interest to help others with their scarring. Didn't think that person existed. Well, thank you, I'm up. Yeah, I mean, definitely, I say before that, I think it definitely helped a ton. And not just with like acne or just with scars, but like just really with almost anything like skin conditions, I would say, that require procedures. And I really do have a different perspective about it. And I know that some people would say that, well, this is something that's not as severe for that person. And I don't know why they're even doing the treatments. But honestly, really, I would say a couple things. One, when I had acne, I felt that I had like the worst cystic acne. It was one of the worst in my school for sure. And like in high school, I felt like there's maybe one other person that sometimes occasionally had it worse. But it definitely was one of the worst in school. So like out of almost everybody I knew, it was like the worst. And that by itself was like really tragic and like unfortunate. So how many people do I know? I just know people in my school. So it like felt like it was just the worst. Now I'm in this world and I see that people have much worse acne. I see that the people have much worse scarring afterwards. But at the time, it really felt like my particular skin condition was just like the worst ever. And so sometimes like there's different variables like that like, I know some people say, well, it's just so mild and it's so superficial, like people hardly notice those things. But, your perspective could be a little bit different because of the group you're in or just like what your expectations are. And it still could affect you. It still brings you down. And I was really I was really upset with the way I had to do my acne treatments and not just my scar treatments. I mentioned that many times, was like how I ended up not loving the way people were treating scars, especially in America. But also acne, and it hasn't even changed in like 25 years, honestly. For the vast majority of people, I hear story after story after story every single day, and just like I'm thinking about it, like really, it was 25 years ago that I was going through. Actually, even longer than that, because I really started breaking out when I was like 12 years old. 12 or 13 years old is really when I started to get acne, and I started taking it really seriously. Even like 13, 14 years old, was really going right directly to dermatologist to try to get it solved. And I didn't want to have acne on my face. I didn't think about scarring, but I just didn't like the fact that like my face was, I felt like more oily. It was more visible to other people, things like that. I could tell people were looking at it. And it was like just constantly like the cycle of like doxycycline and doxycycline, doxycycline. And like, here's like a dose of tretinoin, and tretinoin will break me out. And then I would kind of stop it for a bit because it would break me out, and then they'll put me down as non-compliant for that. But like there was like a lot of different things that were happening. I was only like 13 years old and I was trying to do these things. And now imagine and I had acne up until I was like 26, I would say 25, 26, like really bad acne, I would say, up until that point. So and I was Accutane 3 times. So definitely it was like, and I did all the courses of Accutane completely and everything. So it's like I did everything. I had a lot of oil production. And I just found that like getting on Accutane was really a challenge. Like all those things were just so frustrating to go back and forth. And it just hasn't changed much. It's pretty wild when you actually think about it. Like after, 25 years, it hasn't even changed too much. Really hasn't. It's really, really problematic actually. And that's why it's nice that we finally have like some options. And I know that things like Dapsone are great. Dapsone's a great option. Like I found that like using a sulfur wash really helped me. Like I use a sulfur wash and tretinoin, and that started to work out really, really well for me. So that's why I'm a big believer in those things. It's like I did it myself. I worked on it. And it's like, I want you guys to know that, because it's also like, okay, if you can't afford Dapsone, you do a sulfur wash. I like giving you guys those options. And in my time, there were no topical retinoids. So we couldn't get different gel or Dapoline over the counter. Now you can. So like you can get that, and that's awesome. Or, if you're like going on a trip to Mexico, you could get it over there. Actually, no joke. When I was like younger, I did that actually. I would like I'll pick it up like tretinoin, because it was so expensive. It's gotten way cheaper now, but it was so pricey actually when I was like a college student. And we went to like Cancun one time, and I just got it from like a pharmacy over there. and I ended up getting a bunch of those because it was cheaper. So it's interesting actually when you actually think about that, and like and think about this part when you actually like it's kind of interesting. Like I come from like a my dad's a cardiologist, so it's like I'm not like from a poor background or anything, but I was still cost conscious. It's still like this stuff was still expensive still, like doing these creams, things like that, and it was still like upsetting to have to ask my parents for the money for these things, even though I know that they'll do it. Just like I didn't want them to do that. And it's like here's an option. You could pay these out of pocket costs, and sometimes a dermatologist would just put me on it for like a month or two, and then I'll do it again. I'll go to them again, and now it's like, oh, it's not effective. Let's go change it again. And that was like a $300 cream that my parents just bought, and I felt guilty about it. And then we have to like change it to another thing, and to another cream, and then we have to change it to another thing. And it's like, now imagine if you didn't have much money. And like, yes, it was okay for me, but like I still like felt the cost of it. I was still like, that's really unfortunate that my parents had to spend $300 on creams like this, and then we have to change it again. You just feel kind of guilty about like this whole cycle. And then you go to the dermatologist's office, you have to pay for that copay. You're doing everything else for everything, like all the other things if they have to do for it, and you're getting charged for that on top of it. It's like a pretty expensive price point. And that's why, really interestingly enough, acne and then scars really do affect poor patients a lot more than they do patients who are in the middle class or upper middle class, or of course in the wealthier class. Really, it is something that makes poor patients suffer more. And it's really, really wild and unfortunate actually when you actually look at it this way, because they suffered from the fact that they couldn't get quality care. And even if they got quality care, it was difficult to afford the medications out of pocket. And then they ended up suffering from the consequences of it with the terrible scars. And now they have to, suffer from the scars, or pay for those scars. And it's like, man, this is really tough. Like, think about that whole cycle now. Think about just like the fact that, a lot of you probably don't have to, maybe the fact that, you didn't have to go through that, or you did, I'm not sure. But like, just think about now all the poor patients, poor people out there who did have to go through that. And it does, it should at least give you a little bit of empathy for them, and really make you upset with the system that we have. Really, it really should just make you look at this and think about like, why is it that just because somebody was born in a different zip code or, a different part of the country than I was, and they have to suffer more from something like this, and they suffer for a lot longer. And people will just look at this and think this is just a cosmetic issue. This is just something that's not that big of a deal, all that stuff. And clearly it's much more than that. Clearly it's affecting a lot of different aspects of this. And it also, I'm a really big believer in this, that it really does cause loneliness. It really, really does cause loneliness. The acne part causes loneliness. The scars cause loneliness. The pigmentation causes loneliness. The volume loss that occurs when you get acne and scars, all that could cause loneliness. And what I mean by loneliness is that because like myself, I knew that there were times I didn't go out with my friends, in college because I had breakouts. I know for a fact. In high school, I felt like self-conscious. I was extremely self-conscious. Someone saying acne feels like modern leprosy. It really did feel like that in high school, especially. And I think it probably got a little bit better now, but I really did get like bullied by that. As much, it was, maybe they didn't intend to, but like, it felt like it was, like it felt like I was just being like, people were making comments about this stuff and things like that. And it's like, now imagine if you don't have much money, and I was in a private school, and it's like, and it's like, clearly it's like, even affecting someone like me. And now imagine people that don't have much money. Just imagine that. Like, imagine how terrible that is. Are my scars all gone? I don't see any. I have little bits of it, like tiny little bits remaining. I'm going to keep on chipping away at little bits. So just stay tuned. But yeah, you could see a little bit of it. If you look at it under like angle lighting, you can still see. But I am like, I am somebody who could showcase that scar treatments can work over time. It's just slower than maybe you expect. But there's a way to do it that's effective. It's usually something that's a lot slower than you may expect too. It's really is. It's not like a thing that's like a process where just a matter of a few months, you're going to see like the full complete correction. And I understand it's a lot of money. I understand all that, but like, it's just the nature of this. It's a lot slower than people may expect. We're remodeling skin, but there's a way to do it effectively. And part of the thing I'm talking about here is that I want you to avoid it in the first place. If we could avoid it in the first place, of course, then we ultimately avoid a lot of suffering, a lot of money that you don't have to spend then. It's Michelle saying, I've taken everything for acne. My skin isn't as bad as it used to be, but I still get breakouts. I've never heard of Dapsone though. What is that, a topical or oral medication? It's a topical medication. I'm so glad you said that. I'm so glad that you said that you never heard of that before, because that means, at least for one person in this talk, you guys have learned that you should be asking people, your dermatologist, your physician, you should be asking them to place you on something like Dapsone. Put you on a sulfur medication. If you don't have a sulfur allergy, use a sulfur medication. It's going to help you with that bacteria that's living on the surface of your skin. And what's nice is that it doesn't cause much antibiotic resistance unless you're combining it with something like clindamycin or something like that. So really, really useful medication. And then, if you're not getting overly dry or anything like that, you continue using it. If you are getting dry, then yeah, I would back off and do something like just like a sulfur wash. Why is acne so bad in the early 20s? There's usually a bit of a surge. Usually, a lot of times there's a surge of testosterone. Han is saying, my skin is flawless now. Appreciate you, Han. Thank you. It's always good seeing you, by the way, Han. I appreciate you coming on today. Michelle is saying, I want to do an online consultation. How much is it? I don't have insurance. So go through our website, our pages, go through our website at drqazi.com. Our prices are on there right there. So just go ahead there and you can see that there. Sailor Moon saying, why are laser devices so expensive? That's why it's expensive for us then. Actually, that's a really good question. I'm going to go through that talk at some point. Maybe I'll make some videos. It's actually really worth going into it. Really worth going into, because, I don't think people really quite understand that there's these laser companies that they charge sometimes like $200,000, $215,000 for their devices. And it's like, unless you're using a little ton, it's extremely, extremely difficult to justify that cost, and really, really difficult then to make your money back. So it's, extremely expensive in our country, and then it'll be a lot less expensive in other countries. And the interesting thing about lasers is that they depreciate a ton. So you could get it from outside, outside sources. Just get it. There's a lot of companies that sell used, refurbished devices. They have excellent, warranties themselves. They take care of it completely too. But people that I have a lot of people that ask me, how do I start in this field and things like that, and a lot of physicians that want to go into it. And I tell them, especially when you're starting out, don't just buy from these device companies anymore. Just don't I think we just said, just really quit with buying things from these device companies. You are really just putting things in for their own shareholders and their investors. $215,000 device can end up becoming like $50,000 on the refurbished market. And then you could maybe make your prices a little bit more competitive then too. You could potentially help a little bit with that then too. There's really no reason to go directly with a lot of these companies. And I can name some. I'll tell you all the different companies out there one day, and the ones that I've really just don't even like. I hardly even use them anymore, because I find them to be so problematic, the way that they do business, and the way that they take care of their customers. How do you know the refurbished ones are efficient? So yeah, they, you go through proper channels. There's a few companies that are very, very good at it, extremely good. They have their own technicians. They go through it. They're basically just like the laser companies. And they're totally, they know the devices inside and out. It's just not necessary to get it directly from the company, to be honest with you. It's just not, especially in this day and age. I don't know if you're trying to go into this field or not or anything like that, but really, if I would start over, I would just tell people, don't listen to the reps, really. A lot of these guys just lie to your face, just say random things that just try to get a deal. And instead, can strongly consider going into the refurbished market. And there's a few companies out there, if you're interested, I can tell you about them, that do an excellent job. And on top of it, they have their own technicians, and they'll just keep checking out the devices. So in fact, actually, a lot of times the devices that I get directly from these companies, I will have a lot of problems with these devices. Yes, sometimes they'll fix it and things like that, but it's I don't know why they're so poorly engineered sometimes, and they're charging $215,000 for these poorly engineered devices. And then outside the country, they're so much cheaper. So, there's clearly a process where they're jacking up the costs and they're trying to justify these reps' salaries and things like that. And, to be frank and honest with you, I'm pretty upset with a lot of these guys at this point now. Like the way that they've lied and the way that they do things, the companies do, not necessarily even the reps. I would say those the higher ups. I would just try to be clear about that. Like sometimes I'll meet like their managers and like the owners of these practices or these companies, these laser companies, and they're just very unscrupulous in the way that they try to present it. Like, you go to these conferences and they'll make it into like it's like a Vegas show or something like that to try to sell these laser devices and start telling you like the science behind it. And it's just like you ask them for evidence or anything like that. There's never any evidence. Like they just don't have anything. And here you just have to trust us. You just got to trust the fact that we're a laser company and we're going to tell the truth. Like why would that really make sense to me? And why would a laser company like that has a terrible reputation be something that I would try to follow along with when you have zero studies to showcase for this? Is 3 sessions of Subcision good for mild acne scars? The Subcision by itself, typically I just do a single session. Usually you don't do more than that. You don't have to typically do more than that. So I would say that you don't necessarily need 3 sessions. I heard most adverse events, let's start over. I heard most adverse effects people have from Thermage is because of refurbished machines and the software not being up to date. I don't use Thermage, so I can't really comment on that. But by itself, I've had other patients that have used it, and they've said that there was some complications with it. I'm wondering if that's something that the device company potentially just use it as saying just to kind of punt the fact that maybe the device is causing fat melting and things like that. These devices could potentially cause its consequences. So it's like it's possible that the device company is trying to just say that these are all just refurbished machines. They are incentivized to not have anybody use refurbished machines. In fact, they want you to pay for a huge fee to get it recertified. They don't want like the last thing they want is for doctors to sell to other doctors or to give it to other doctors or anything like that. That's like the last thing. It's like the worst thing ever for these device companies, and they want to scare like the world from that. Like that's like the scariest thing in the world for them. It's like it destroys their entire business model. But whatever, it's like I'm obviously not sponsored by them. I'll never be sponsored by them. I don't want to be sponsored by them. I have zero interest in their unethical behavior with so many different things that they do and they push. So it doesn't make a difference to me. I'll just tell you like flat out that there's a lot of problems that their devices will have. You get straight from the company, then you'll have a lot of problems with those devices. And there'll be sometimes you can get it from these companies that are third party and they do excellent ones. So it all depends, who you're getting from. And I would say that's the reason though, like someone was asking why are these treatments so expensive when you're talking about lasers and things like that. One of the big factors though, a huge factor, is the fact that these device companies are so expensive. What they're charging physicians is astronomical. And then on top of it, what they do, and this is why I'm referring to a lot of this is actually kind of alluding to it, is that they hook doctors, into their own little network for financing. That's where it's so shady. It's super sketchy what they do with that. They use certain financing companies and they just so happen to be working with them and like, oh, this is my friend, this is like a separate company, blah, blah, blah. And those companies end up hooking these doctors for like astronomical interest rates. It'll be initially like, interest free for 6 months. And then suddenly it just like hits these physicians like these huge, like literally it sinks their businesses. There's so many med spas around us that are just like shutting down, so many different medical offices that shut down because there's these doctors that push these things, or I should say these reps that push these devices on them. And then they hook them into these financing plans that make it crazy interest rates, like just normal. And it's like this, like a trap. I have a doctor that's nearby me. He has $1.5 million in debt just from his devices. And he's like, I don't even know what we're going to be doing with this. They sold me on this and they told me that was for the patients that I treat, which are Asian patients. And the devices are pretty much for Caucasians. So, the rep didn't care. They just sold them that. My derm prescribed me doxycycline when it clears my acne, but when I stop taking it, acne comes back. You got to control your oil production better. So that's what the Accure laser helps with oil production. Something like oral isotretinoin, that could be an option there as well. What device is it? This is with the Accure laser right over here. This is targeting just oil glands, normalizing oil glands. That's what that process right over here. I feel like all the lasers have caused me facial drooping or collagen loss, unless it's just because I'm 41. I would think my skin would be tighter instead. I still have acne, severe scarring, and droopy skin. Well, maybe that you're just older. You know, it's possible. I can't really comment on what the settings they use for lasers. Lasers, you know, unless they're like really bulk heating, really high heat, unlikely I would say to cause fat loss. But you know, I'm not sure what they did. But maybe you need other treatments instead of lasers or energy devices for your scars. So take a look, drqazi.com, schedule a consultation. I'll be happy to help you. Dr. Karibi, Dr. Khadija saying, do you have online courses for doctors? No. Sometimes we do hands-on training though. At some point, I'll try to open it up some slots this year, but I'm really busy, so we'll see when I can do that. All right, guys, I'm gonna finish up just right over here. I know there's a bunch of questions, so I'll try to finish. Let's see it. Well, let me finish a couple ones back here. Can cheek volume loss come back on its own with time, or is Bellafill needed? You lose that fat. It's really, I don't know how you're gonna get that fat back. Sometimes if you get fat, it'll just go somewhere else, you know, somewhere else in your body. That's not, you know, what you expected, and that's what ends up happening though sometimes. Yeah, so that's, yes, people are asking about, like, it's crazy what the device companies. Yeah, I mean, that's why you should really look into that, really. Take a look and see. That's the reason why a lot of physicians end up charging so much. And if they don't do that much with like these treatments and things like that, if they don't do as many, it's like just to do a single treatment, they're trying to recoup the cost just to pay their interest loans on their device. It's like, you know, and that could be like $3,000, $4,000 just for their interest loans. So something to pay attention to. Thank you for your testimony, Dr. Qazi. I'm from Mexico and I don't have the money to pay all the treatments, so I'm in a career to investigate the molecular and genomics factors to treat acne. That sounds awesome, super interesting. Why don't you send me a message? I love going into that actually. That'll be a really cool thing for me to go into one day. I would love to go into the genomics of acne. So why don't you send me a message actually? I'll be really interested in that actually. So we'll love to hear about that. All right, guys, thank you so much. I'll see you again tomorrow night. Thank you guys, take care.